Hi everyone, my name is Xiang Gao. I am a second-year medical student with the Washington State University Elson Floyd College of Medicine in Spokane, Washington. And today I am presenting on optimizing thyroid scintigraphy for hyperthyroidism using technetium-99 pertechnetate as a radiotracer. So just for a bit of background, hyperthyroidism is a common condition that affects up to 1.3% of the global population, with Graves' disease being the most common cause, amongst many other causes. One important differential from Graves' disease is subacute thyroiditis. And in the absence of clinical symptoms of Graves' disease, you would do a thyroid scintigraphy to differentiate between this and thyroiditis. And this is done by administration of a radiotracer, followed by a waiting period for uptake, and then nuclear imaging to calculate the thyroid uptake ratio from the thyroid relative to other regions of the body, such as the mediastinum or the neck, salivary gland, and right lung. And a higher uptake ratio would indicate Graves' disease, a lower would be subacute thyroiditis. The most common radiotracer for this is currently iodine-123. It's also the standard, and it's because it has a very high resolution on imaging, which is very good for identifying nodules. It does, however, have a long period of waiting between administration and imaging. It spans about 2 to 24 hours before you can take images. Whereas another alternative radiotracer is called technetium-99 pertechnetate, or TC99M. It is faster because it only takes about 20 to 30 minutes after administration for imaging. It does, however, have a lower resolution compared to iodine-123, so it's not as useful for identifying nodules. But in this setting, the more important factor is the quantity of the uptake ratios, which could make technetium-99 a potential option. Iodine-123 has well-defined uptake patterns, whereas technetium-99 pertechnetate patterns are not as standardized for differentiating this etiology. So with that, we did a retrospective review of 78 patients that were evaluated for hyperthyroidism at an outpatient imaging center. The diagnosis of the patients were 45% of them had Graves, 24% had thyroiditis, and then the rest were multinodular goiter, autonomous nodule, and other was normal. Only the patients with Graves' disease or thyroiditis were included in this study, which comprised a total of 37 patients. Thyroid scintigraphy was performed by intravenous injection of technetium-99 pertechnetate, and then wait with 5 millicuries of this injection, and then waiting 5 or 25 minutes before imaging. Figure 1 here shows the image of the thyroid at 25 minutes post-injection with technetium-99 pertechnetate. And an image like this was compared with images of the mediastinum or the neck, salivary gland, right lung, and then that was how the thyroid to region uptake ratio was calculated, which over here on the right, there's table 1, which shows the regions that we studied. And it also shows the correlation coefficients of technetium-99 uptake ratios to a clinical diagnosis of thyroiditis or Graves' disease. All of these correlation coefficients were significant with a p-value of under 0.002. The columns represent the time that was between the imaging and administration, and you can see the 5-minute and 25-minute correlation coefficients were very similar. And we did, in fact, it almost looks like the 5-minute is better, but we did do a Fisher's z-test on this, and there was no significant difference between the two. The lowest p-value was 0.384, and it went up to over 0.9, which is all significantly larger than 0.05. So from this, waiting 5 minutes or waiting 25 minutes after injection with technetium-99, it's not inferior to wait 5 minutes. We then did the ROC analysis of all of these uptake ratios and times with technetium-99. We found that all of them had an area under the curve above 0.85, with the exception of the 25-minute thyroid to mediastinum ratio, which had a uptake of, or area of the curve of 0.839. All of that is, however, up in the upper left quadrant of this graph, which suggests high sensitivity and high specificity, which supports technetium-99 being diagnostically useful. So with these results, our conclusions include that waiting 5 minutes is not inferior to waiting 25 minutes after administration of technetium-99 pertechnetate, and which may be preferred to wait 5 minutes because it's significantly faster. And in this specific setting of differentiating between thyroiditis and Graves' disease, just for the uptake ratios, technetium-99 pertechnetate may be used instead due to its lower cost and lower radiation exposure on top of its shorter scan time.